In this lesson, we are going to review a diagnosis that affects many patients on a daily basis. A UTI is an infection of the urinary bladder. At least 100,000 organisms per milliliter of urine in an asymptomatic client, or more than 100 per ml of urine with pyuria in a symptomatic client, meets the criteria for a UTI.
There are two types of UTIs, upper and lower tract infections. UTIs can also be uncomplicated with a healthy, normal urinary tract system treated with antibiotics by mouth, or complicated for those that are immunocompromised or have an altered urinary system and require IV antibiotics.
The incidence of UTI for young men is very rare from ages 15 to 50 and can be as high as 15% in geriatric males and females.
Approximately 6 in 10 women will experience a UTI at some point in their life. Older women are also affected due to the estrogen-mediated dilatation of the urethra. Elderly male infections are related to problems with the prostate and instrumentation.
Bacteria ascend from the perineum through the urethra, with E. coli acting as the most common culprit.
Predisposing factors include female gender, poor hygiene, sexual intercourse, diabetes, and anomalies of the GU tract.
The most common symptoms are burning on urination, increased frequency, cloudy or bloody urine, and urgency. The elderly may not have any symptoms or present with fever, incontinence, or mental confusion.
On physical exam, the nurse practitioner may discover CVA tenderness or suprapubic tenderness. Diagnostic testing includes a clean catch urinalysis with reflex culture. Abnormal findings on a urinalysis that may indicate infection include cloudy urine representing pyuria, pus, blood cells, phosphate or lymph, an offensive odor, a pH greater than 7.5, positive leukocyte esterase, and nitrates.
Treatment is aimed at identifying the underlying cause and initiating medication promptly. In the case of an uncomplicated UTI, antibiotics should be used for 3 days. The duration may be increased to 7 to 10 days for complicated urinary tract infections.
Empiric antimicrobial therapy should cover all pathogens and be confirmed based on a urine culture. Post-treatment urinalysis and culture is not indicated. Have the patient return if symptoms do not resolve at the end of treatment or if they reoccur within 2 weeks. You may also consider retreatment with 7 days of a different antibiotic. Advise the patient to empty their bladder often and avoid holding their urine.
Schedule bathroom breaks every 2 to 3 hours if needed. For females, reiterate good hygiene habits like wiping front to back, taking showers instead of baths, voiding after sex, avoidance of feminine sprays and douches, and avoidance of tight underwear and clothing.